You're totally in there. I just started it because we're going for imperfect and
Okay,
That's good.
thank you, Linda.
nothing.
And these are the handouts that people will get. This is very much a draft, that one. So let's also time it. Okay. Oh, can you pause it for a second? Sorry.
No, just
Okay.
keep going.
So, I definitely want to time it, so I think we'll just go.
I'll time it.
And then, okay, as you think of things that you want to give us feedback on, write them down. Perfect. Okay. All right. Welcome, everyone. Crystal and I are thrilled to have the opportunity to share this information with you today. Thank you for choosing this breakout session and for your interest in helping to create happier, healthier workplaces and employees. So let's jump right in. Our goals for the next hour or so are to, first of all, talk about the impact that workplace stress has on our health and happiness, because if we're going to tackle this topic at the workplace and put things in place to help our employees feel better, we first have to understand how the workplace is likely contributing to our employees' unhappiness and mental health issues. We'll also provide you with a wealth of resources and ideas to address mental well-being at work, including a low and no-cost resource sheet that we'll leave you with today. You'll also get a chance to hear how one local workplace, Metropolitan Council, has utilized some of these tools and what they've learned along the way. And then we'll spend a couple minutes actually practicing a couple different techniques so that you can get a feel for some of these tools yourself. And then lastly, we'll provide time for you to identify some action items that you'll want to take after leaving here today. So to start, I want you all to think of a time that you yourself were unhappy at work. And as I read through this list, just raise your hand if any of these things resonate with you. Overwhelming workload. How about not feeling connected to what you're doing? Noise, light, or temperature distractions in your work environment? Conflict with a manager? Feeling left out or isolated? Workplace bullying? Affected by a mental illness, either yourself or a loved one? Lack of recognition for the work that you're doing? Stressors at home sort of overflowing into your workday? Feeling micromanaged or like you don't have control over your work? Conflict with a coworker? Lack of self-care possibilities. Okay, so clearly work itself is a source of stress and unhappiness for some of us, and we're even in the business of promoting health, right? So in order to address mental well-being at work, we really have to take a two-pronged approach. So as the slide says here, if you put a healthy fish in toxic water, the fish will get sick. If you take that fish out and fix it, but then put it back into that same toxic water, it will get sick again. So in other words, we can't just offer programs and services to help our employees. We also may need to look at the organization itself and put some changes in place to prevent some of these things from happening in the first place. And now Crystal will highlight what some of those workplace happiness factors are.
So I'm going to go through some of the things that we know about things in the workplace that can cause happiness or unhappiness more so. We'll hear much more about these in this afternoon's keynote that I am so excited for. But just to highlight some of the things that we know about workplace happiness factors. We know that your immediate supervisor is more important to your health than your primary care physician. 98% of employees are going to experience or witness workplace incivility. And each of these microaggressions can wear away at our experience and cause a moral injury. We know that loneliness is worse for our health than obesity or smoking a pack a day. This loneliness can come from purposeful isolation, lack of representation or diversity, a lack of inclusion, which is a little different than diversity, disconnect or lack of recognition for your personal strengths or contributions, or how team strengths play together. And again, this goes hand in hand with that workplace incivility. And research is also now showing that frequent positive exposure to our weak connections, which are also known as acquaintances, has just as much impact and is just as fulfilling as having a handful of deep connections and deep relationships. So it's not just having close people and best friends at work, as we hear from Gallup, but it's also about just exposure to people. We know that people want to feel like what they do matters. We know that people want to say in how their work is done, and they want their voice to be heard. And this is not just for office workers, but also for our frontline workers. We know that people want to have continued growth, both as an employee and as a person. And we want to feel like our work matters, both in the bigger picture and that it's tied to our own personal purpose. Burnout has been in the news a lot lately. Don't have to talk too much about how much burnout impacts us. And where we work, the built environment where we work has a great impact on how we are able to show up and work every day. This is everything from noise to temperature to air quality, availability of green space, light quality, all of these things. Stigma impacts us every day. There's another great breakout today that's talking about stigma, but stigma is a barrier in people seeking the care and taking advantage of the opportunities that exist for fear of being judged just for even seeking help. And we also know that employees face 6 or more barriers to taking advantage of the resources that we offer in the workplace. So even when the help and the opportunities are there, they're not always really available to our employees.
So in addition to work and the workplace itself, being a potential source of stress and mental health problems. There we go. Okay. Some of us as individuals are also just more likely to experience and deal with these issues, sometimes for reasons even outside of our own control. So before I touch on these things that you're going to see pop up here, I just wanted to say that these are really big topics that we could easily do entire sessions on. We obviously don't have time to go into a lot of detail on these things, but we just felt like we'd be doing a disservice if we didn't at least mention them. So the first thing is financial stress. And we actually did do an entire Health at Work networking breakfast on this topic earlier this spring. And I think we all know the toll that money troubles and financial stress can have on our health and happiness. And as this graphic shows here, people with high financial stress are actually 25% more likely to suffer from severe anxiety and 19% more likely to suffer from severe depression. Next are social determinants of health, and these are the conditions and the places where people live, learn, work, and play, and they affect a wide range of health risks and outcomes. So some of the factors that have been linked to mental health in particular include race, gender, age, income and education level, sexual orientation, and geographic location. There's also ACEs. How many of you have heard of ACEs? Okay, so this stands for Adverse Childhood Experiences, and it's basically childhood trauma. So things like abuse, neglect, domestic violence, just to name a few. There are 10 ACEs, and essentially the more of these things that you experience growing up, the more likely you are to suffer from mental illness. Next is HOPE, and this is sort of the opposite of ACEs. How many of you have heard of this? So HOPE stands for Health Outcomes of Positive Experiences, and is really new research into the new insights on the role of positive experiences in child development. And then last but not least, unfortunately, we are all hardwired to more easily see the negative in life. So if you can see, brain, look, there's a pile of good things happening right in front of them, but nope, we're too busy looking at the one little bad thing that's going on. So this is reversible thanks to something called neuroplasticity that we will talk more about in a moment, but it does take work, and if we lack the skill set or the desire to work on it, that will impact our happiness as well. So again, these are all big topics in and of themselves, but they are things we need to consider when we're looking at the whole person. And if nothing else, they help demonstrate that there is really a scientific need to address this stuff at work, right? I think that many people, maybe even some of our senior leaders, still see this work as sort of fluff, but clearly there is a need to address it. And I think the fact that our 2 keynotes today are talking about this topic as well really further validates that there is that need. So, now that we've talked about the many reasons it's so easy for us to be unhappy, we are going to take a moment to practice one skill that has been proven to help us combat this. And then we'll get into some more of the mental well-being resources and tools that are available.
Great. So knowing what we know both about the context of where we work, how we work, our environment, but also the personal responsibility to do something about it. We all have much, much more power than we think over that. So we have the personal responsibility. So let's practice one strategy to combat some of the incivility, conflicts, hostility, things like that we might face in the workplace. So this is a tactic that is more of a personal level tool, but could be expanded into a program, into an offering, into something that you offer in the workplace, and expanded to fit your organization's needs. So this could be just a personal practice. It could be expanded into something you offer as a strategy in your workplace. So practicing kindness is one of the most direct routes to happiness, and research suggests that kind people tend to be more satisfied with their relationships and with their lives in general. We all have a natural capacity for kindness, but sometimes we don't take the steps to nurture and express this capacity as much as we could. So loving kindness meditation, sometimes called a metta meditation, is a great way to cultivate our propensity for kindness. It involves mentally sending goodwill, kindness, and warmth towards others by silently repeating a series of mantras. So loving kindness meditation increases happiness in part by making people feel more connected to others, to loved ones, acquaintances, even strangers. And research suggests that when people practice loving kindness meditation regularly, they start automatically reacting more positively to others. And their social interactions and close relationships become more satisfying. It can also reduce people's focus on themselves, which can in turn lower symptoms of anxiety and depression. So settle into your seats. Enjoy this for your own experience today. So this is permission to turn off your thinking brains. I'm going to sound a chime to really help us trigger that so we stop thinking and just start experiencing. And here we'll either have a chime or a bowl or something to make a sound easier.
For this loving kindness meditation, find a position that is comfortable but alert. Imagine a string is pulling up through your spine and let it go. So your spine is elongated but your muscles are relaxed. Gently close your eyes and draw your attention ever so lightly to your breath. Say the following affirmations to yourself. May I be filled with loving kindness. May I be healthy and happy. May I accept myself exactly as I am. May I be safe. And may I be free. Now imagine someone who you dearly love and repeat these friendly wishes in your mind. May you be filled with loving kindness. May you be healthy and happy. May you accept yourself exactly as you are. May you be safe. And may you be free. Now choose to envision someone who is neutral to you. Someone you may have passed on the street today, or sort of a familiar stranger, and send them these wishes. May you be filled with loving kindness. May you be healthy and happy. May you accept yourself exactly as you are. May you be safe. And may you be free. challenging lately. Someone who may have caused you difficulty. And surround their image with these thoughts. May you be filled with loving kindness. May you be healthy and happy. May you accept yourself exactly as you are. May you be safe. And may you be free. Now send these loving thoughts out to the entire world. May you be filled with loving kindness. May you be healthy and happy. May you accept yourself exactly as you are. May you be safe. And may you be free. And finally, returning to yourself once more. May I be filled with loving kindness. May I be happy and healthy. May I accept myself exactly as I am. May I be safe. And may I be free. Namaste.
So take a moment, wiggle your fingers and toes, open your eyes. How did that feel? So maybe think about someone you've had some discourse with and wish them well. Yeah.
Seemed useful, seemed like practical tool.
Yeah, it's a great way to kind of calm those feelings of good and bad towards our coworkers and people we know. So I'm going to pass it back to Kelly now to talk about some of the resources. What am I doing?
Okay, thanks, Crystal. So now we're going to move into some of the different mental well-being resources and tools that are available for you. A few of these things we'll go into detail on, or more detail on, specifically these 4 that are listed here. I'll provide a little bit more detail on, and Krista will also talk about their experience with some of these programs, and then we'll also leave you with that resource list, which we mentioned. So the first thing that I want to talk about is perhaps the most obvious, and that is tapping into your employee assistance program. So depending on who your provider is and the terms of your contract with them, they likely have classes available on stress management and resiliency, and may even be willing to come and introduce themselves at a staff meeting or at a drop-by table. I think EAPs can sometimes be hard to navigate, so your employees just might not really get how it works. We recommend partnering with your employee assistance program to better communicate to your employees what's available and also how to go about using the services. So you may just need to do a little education to remind your employees that using EAP is confidential and that they don't need to ask permission to use it. And then also be sure to let them know about all the services that your EAP provides, and that it's not just for crisis mode like I think sometimes employees may think. So let them know that your EAP can provide support for things like caring for aging parents, tax time questions, career tips, or even just general work-life balance. So that could also probably help a little bit to take away the stigma associated with using it. So again, we recommend reaching out to your EAP. I think they'll likely welcome the opportunity to help promote their services. And when I worked as an on-site coordinator at Fairview, this was years ago, we even teamed up with our EAP providers to teach on-site classes. We did want to even remember the name. It was called Stress is Dessert, spelled backwards. We also staff drop-by tables together with the EAP staff to let the employees get to know the providers, kind of put a face to a name, and then let them know the services that were available to them and how to go about utilizing those. So I don't have access to that data anymore, of course, but we did end up increasing the utilization rates quite a bit by teaming up with them. So it was really a win for them, for us, and for our employees. The next resource I wanted to touch on is a program called Path to Positivity. How many of you have heard about that or maybe even implemented it? Awesome. So this is a turnkey mental well-being campaign that we, Hennepin County, developed back in 2016 to help wellness coordinators more easily address mental well-being at work. And to date, we've had over 300, I need to check that number, local workplaces implement the program. And each year we've updated a little bit based on feedback from those of you who have done it, as well as the latest research on positive psychology. And we base the campaign around two principles. The first is something called the happiness equation. And how many of you have heard about that? So that is based on the research of Sonia Lyer-Bomirsky. I have to work at saying her last name better. And her book, The How of Happiness. And the book that I'll bring has the pie chart on it, so people will be able to see that how happy we are is actually largely up to us, 50% to be exact. What her research showed, if you're curious, the other 40% is genetics and 10% is life circumstance. The second principle that we base this campaign on is the fact that thanks to the growing field of positive psychology, we now know there are things that we can do that have been scientifically proven to boost happiness. So not only are we largely in control of it, but there are things that we know can help boost it. But different things work for different people, right? We're all unique individuals, so this is why we created the 3 different paths. So employees can choose to work on either connection, mindfulness, or purpose. There's also a simple 4-question subjective happiness scale that we pulled from this book as well to kind of help your employees assess where they're starting at, help them determine their current state of well-being. And then the first week of the campaign, the employees read through the materials and decide which of the paths they want to take and learn more about it. And then the remaining 4 weeks, they're choosing from a list of different happiness actions to practice and kind of tracking their progress and any learnings and aha moments that they have along the way. So the coordinator guide gives you everything you need to implement Path to Positivity in your workplace, and as with all of our campaigns, you are free to customize the materials to make it a success in your unique workplace. And Crystal has implemented Path to Positivity twice now, so she'll share their experience with that as well in a little bit. The next resource I wanted to talk about today is another turnkey campaign available from us called Take Charge at Work. Has anyone implemented this program or heard of it? Okay, so Take Charge at Work is both a toolkit for you as the wellness coordinator as well as a set of activities for your employees. And this campaign draws upon the Gallup organization's research, or rather there are 5 elements of well-being and then also what has worked well at innovative Twin Cities workplaces. And according to Gallup, as you may have heard, career is the element of well-being that most strongly influences a person's overall sense of well-being. And in fact, if you have high career well-being, you are more than twice as likely to have high overall well-being. And this gets back to some of what Crystal was talking about in the introduction as well. So Take Charge at Work offers specific strategies to help your employees work on autonomy, mastery, and purpose, as well as connection and recognition. Again, things that Crystal mentioned in the beginning as being very important to high career well-being. The toolkit materials give you everything you need, and will kind of guide you through choosing which strategies to start with, given your unique organization and workplace, and it's really meant to be tailored to best meet the needs of your organization and its employees. And then the last resource I wanted to make you aware of before I turn it over to Crystal is Happy Hour. So how many of you have heard of Happy Hour? Okay, and I'm not talking about the kind that involves cocktails and appetizers. Crystal and I are both actually proud certified happy hour facilitators. And this is a 10-session program that came into being back in 2011, actually, through the Rice County Mental Health Collective. It's gone through many iterations and updates since then. The most recent curriculum was developed by Carleton College in partnership with St. Olaf University. And this is a train-the-trainer program, so much like Past Positivity and Take Charge at Work, you as the wellness coordinator would attend a training and learn how to facilitate this program at your workplace. This training, however, is a lot more lengthy than ours because it's a 10-session program. The training, I think, was 4.5 days. So it's almost a full week, but it was a really great experience. The program is similar to Past Positivity in that it is rooted in positive psychology and is designed to teach people the skills to flourish and improve their overall mental well-being. And these are some of the main interventions that the 10 sessions include. So there is a session on positive emotions, and that is the work of Barbara Fredrickson, which she outlines in her book Positivity. And by the way, all these books will be on your resource list as well. Barbara Fredrickson is really one of the founding pioneers in the field of positive psychology. There's also a session on neuroplasticity. So how many people have heard of neuroplasticity? Okay, great. So that is basically the fact that we have the ability to change the neural pathways in our brain. So as we mentioned in the beginning, we are unfortunately hardwired to more easily see the negative in life, but there are things we can do, meditation for example, that over time will help us to actually change that so that we can more easily see and focus on the positive in life. There's also a session on optimism, and that is the work of Martin Seligman, which some of you have probably heard of, another pioneer of positive psychology. We're hearing lots and lots about gratitude lately. There's an entire session on that as well. Strengths and virtues, so learning how to focus on the things that we're already good at. Engagement, meaning or purpose, and then positive relationships and connection. So the format for happy hour is 10 in-person group sessions, and then some homework assignments for your employees to do in between. So Crystal has also implemented this program at Metropolitan Council, so she will share their experience with that in a moment as well. So there really is a lot available to us to help us address mental well-being at work, and this wasn't the case just a few years ago. So we wanted to leave you with the resource list so that you have, you're aware of more programs and tools that are out there. And this list includes both programs to address those employee happiness factors as well as policies to address those workplace happiness factors. Because as we talked about in the beginning, this sort of two-pronged approach is really what will help you be most successful. So we've organized the list by type of resource, so hopefully it's fairly simple to navigate it. And we've included hyperlinks as well as the actual web addresses since we're disseminating it via hard copy to you. But if any of you would like an electronic copy, just drop your business card with me afterwards and I'll be happy to email it out to you. So, okay, I'm going to now turn it over to Crystal, who will talk about some of the resources and tools that they've used.
So hello again, everyone. I'm going to talk about what we've done at my Worksite, the Metropolitan Council. So a little background about our organization. We are a public agency, so we do work within the government system. We have about 4,500 employees spread across 30 various work sites across the Twin Cities region. And we are represented by 13 different unions, so different bargaining groups. Our 5 main divisions are Metro Transit, so all the buses and trains you see across the metro. Environmental services, which is wastewater treatment, so anytime water goes down a drain or a toilet, that is our business. Community development, housing assistance, transportation services, which is different than Metro Transit, that is the metro mobility, buses you see that help get our citizens around, and then regional administration, which is all of the background admin services that help all of these things run. Fit for Life is the program that I work under. That's our internal employee well-being program. And our program originated back in the 1980s as part of a safety initiative. And so we've been around for quite some time. I think that speaks largely to the amount of commitment our leadership has towards our employee well-being. And it has, of course, evolved over the years back from the 80s to where we are now. So currently we have 2 dedicated wellness staff, myself and my manager, and then a part-time health coach through our insurance administrator, and then various vendors that help us complete the work that we do. Our guiding principles and our purpose, so how we operate, why we do what we do. Our purpose is to value, energize, and engage each other to be our best selves at work, at home, and everywhere we go. So we do that through various ways. We of course address physical health, nutrition, stress management, our holistic view. But our guiding principles is that everything we do is attainable, relevant, and whole life. So through getting to know all of our employees and assessing what we do, we have greatly realized that we can't help our employees be their best selves if we're not talking about resiliency, happiness, and stress management skills. So how we put together our strategic plan for all of our employees is a very multifaceted approach. So we rely on PSE, which is policy, systems, and environment, other public health models. We look a lot to behavior change models, which are very well known within the wellness industry. We look to our different industry thought leaders. We look at industry best practices, and then we also look at what's the best fit for our people. As we all know, there's not a one-size-fits-all approach that works for everyone, so we really need to make sure that within all of this information that we know, that we find what fits best for our employees. So what we do know about our employees is that each of our work areas has very different needs. Our transit employees have very time-sensitive, public-facing jobs. They deal with the public every day, getting in and off of the buses. It's very time-sensitive, so their stress comes a lot from timestamps, bus routes, schedules, those types of things. Our environmental services have much more work-life balance stressors. There's a lot of overtime that comes into play there, so family life, home life balance is a stressor of theirs. And then regional administration has more of your classic organizational stressors and workload stress. What we've also found more from the programmatic offerings is that we need to vary how we offer different things. So online works great in some places, in-person works great in other places. We also need to offer things live and in person, and then we also need to offer things on demand, self-paced, and streaming. We also know that group sessions and group settings work great for some groups, and then we also need to offer individual help. So again, it's about tailoring everything to our employees' needs. Other considerations, union relations. If anyone here works within unions, we know that can be sometimes a pain point. And so we can't always address union contracts. There are some things that are non-negotiables, such as earning time off or being able to do things on the clock. We can't necessarily do anything about that. That's all bargained for, but we can help people connect to other services or connect back to their unions. Within the union relations, we know that our employees don't necessarily 100% trust that the overall organization has their best interest in mind. There's a little bit of that contentiousness going on, and often our employees don't feel like their voice is being heard, so we have to be mindful of that. Other considerations about how we choose what to offer, we need to be mindful that we are a government agency and everything we do has to serve the public purpose. So some different considerations into how we select and do what we do. This has been a growing plan, so stress and resiliency has always been a part of what we offer within our overall structure, but back in 2017 we really started ramping up our efforts in these areas as more and more research came out about the workplace and stress, and just from the desires and what we know about our people and from their requests. So back in 2017, we did much more of a push to start raising awareness about mental well-being. We started doing some things to reduce the stigma and just make more of a presence known. We started increasing our opportunities, and we started planting the seeds for some of our longer-term projects that we knew were going to take some more time. In 2018, we just continued on with our goals. We stepped up a little more work with our leadership, and we started refining and tailoring some of the things that we were doing. And now in 2019, again, a continuation of what we've been doing, continued enhancements, and now we've really started dovetailing what we offer to complement other things going on within our organization. So what our strategic plan looks like today, how it's laid out, a little overwhelming, but I know that this has been a growing effort over the past few years. So we do have a lot of effort within our leadership support, things like our executive wellness steering committee, executive messaging. This is where we're working on policies and procedures, partnering with the EAP. We have an on-site clinic. We do some things that are offered council-wide. So the Path to Positivity project, or the Path to Positivity, Bounce Back, different offerings that are available across the board to all employees. And then we know that different groups do need some tailored efforts. So we have some other things here that are very specific to the work groups, either in how they're offered or just a demographic that needs some different types of attention. So to go, that's right. And beyond that, we know that because the workplace, so the wellness program doesn't necessarily own all of the efforts that impact happiness in the workplace or impact stress, but it is vital to know what the other resources are and what other work groups are doing. So even though we may not have a part in these, it's important to know when they're happening so that we can help refer and support these things. So these are things like the entire learning and organizational development, if you're lucky enough to have a whole department, or if it's just one person, or just knowing what's available. There's peer support groups that exist within the organization, knowing what's going on with your equity committee and knowing if and when you can partner with them. The Red Kite program, is anyone familiar with Red Kite? No? So this is a program that's being offered just within our transit agency, by the transit agency, or by Metro Transit. It's a trauma resilience program. So this one is fantastic for some of the things that occur on the buses that are very specific to bus operations. And then mentoring programs. So again, not that we necessarily own these, but it is very important to know that they're happening so that we can help support their efforts and refer to them when needed.
I have a question. Is the, like, are there employee resource groups under the peer support? Is that what that is, or is it something else?
Say again.
Where you said peer support, is that like formal employee resource groups, or is that something else?
It's it's like a formal trained peer support committee.
Okay.
So they're trained in, they're not quite to the level of like an EAP provider, but they're meant to be like a frontline step into there.
Okay, but it's not an employee resource group. That's a separate thing, like Spanish-speaking
ERGs.
employees.
Yeah. No, different than.
Okay,
I'll get clarification on how to
Okay.
correctly explain that.
sure.
Yeah,
Got
thank
it.
you.
Thank you.
That's good. All right. So now just to pull out a few of the things that we've done within each of these work groups, I want to highlight some of the major council-wide things that we've been doing, the leadership things. So the Make It Okay campaign was what we did for stigma reduction, and this was one of the most widely reacted to things that we did in this whole scheme. After we rolled this out with leadership, leadership took the leadership pledge to help make it okay to talk about mental illnesses and mental health in the workplace. And we got the largest unsolicited response rate from rolling this out, of people just thanking us for rolling this out and making it okay to talk about this and open up conversations and give those tips to talk about these things in the workplace. Trade Time for Fitness had some kind of unintended consequences. So this is a program where employees can trade in their unused annual leave time or PTO time to be reimbursed for fitness and other well-being expenses. And one of the coolest things to come out of this was the amount of thank yous and gratitude from parents that can now use this program to pay for their children's sports fees. And the number of emails and thank yous I've gotten as I'm processing the claims, because it's no longer stressful to pay for their kids' hockey program, has been quite a success. Our new parent packet and paid parental leave, this again just shows the great support from the organization to a specific group of new parents. So the new parent packet is something that the wellness group did put together to help streamline questions on paperwork, where to get your questions answered, has a host of resources for all parents, so mothers, fathers, partners, both for birth parents, adoptive parents, foster parents, but just one place to go to get all of your questions answered and give support for our new parents. And then the paid parental leave was a policy that we passed late last year to grant all new parents 6 weeks of paid leave to care for their child. So these both together, one, the paid parental leave eases the financial stress, and it guarantees at least 6 weeks of time for any new parent to bond with their child And so again, we talked a little bit earlier about ACEs and hopes, and wow, that's a great opportunity to allow some of those, or to address some of those. So these are some of the things that truly show that our employees truly feel that these types of offerings really show that the organization does care about their overall well-being. Within our regional admin division, so passive positivity, which Kelly talked about, we had 149 participants participate in the program, and the feedback was very favorable. Some of the key responses we got back were being grateful, or after going through this program, they realized being grateful is much easier and less mentally draining than being skeptical. This one other person said it reminded themselves every day why I choose to be with my significant other, and helps me focus on and not focus on the little things that drive me crazy. So how awesome that we can overlap into home life balance. Another person said it's been easier to fall asleep after writing down 3 good things from the day. I found myself adding more than just 3. Another one, feeling a connection with family, realizing I need to start making meditation, exercise, and diet a priority again. Another person made an EAP appointment. And another one, learning is very good for you. I guess I've always known that, but this confirmed it. I signed up for 2 classes with LOD. So again, it shows that coordination between the different departments and efforts. Happy hour was another one that Kelly talked about, and we did our first cohort group this year, and we actually partnered and co-facilitated with another employee that went through the training from Hennepin County. And some of the great things that we pulled out from feedback was a whole division actually came, or a whole department came together and did this as a team building activity. And one of the comments from the group was, I found the gratitude practice most applicable to real life, and it's been a great conversation starter with my team. We started a gratitude Slack channel where we share things we're grateful for. It's been a great way to build camaraderie. Another person noted that they liked learning about what their strengths and virtues were and how that may play a role in their overall happiness. And seeing the connection between that was an interesting discovery. And then another one is, loved being in person and getting to know other people in the building. So great side effect to combat that loneliness that we talked about earlier as well. Then Fitness Flex is another one that's kind of a leadership support and an organizational support one, but Fitness Flex, it's actually more of a well-being flex, but it is a laid out plan and procedure that leadership approved to show how someone can flex their time, so their lunches and breaks and just their day, to allow for time to either do fitness activities or other well-being or fit for life activities. And that's within the union contract. So it laid out a way that both an employee can go to their manager and say, I want to do this, but it also lays out the permission for the manager to feel okay letting their employees do that. So that greatly removes some barriers that we've heard from employees that they didn't feel like their manager necessarily.
So I'm curious about that program. Did it go as far as, like, if I wanted to breastfeed and I had to drive 20 minutes? Like, where were the limits of what one could do in terms of well-being? Did people push it? Has it been?
It hasn't been pushed. Most
Okay.
people use it for if we have an on-site activity or if they want to go to a gym.
Okay.
Yeah.
Just curious. Okay.
Yeah.
Thanks.
We haven't had any pushback from it yet.
Or just people using it creatively. Like, what I could really use is
Creatively,
time to
I
go
love
get
that,
my
yeah.
car fixed. And
It wouldn't cover that.
Like, if it was caregiving, like, I really need to take care of my sick dog that has a small bladder or whatever, like, do people want to push it to, like, what's stressing me out is somebody else, or breastfeeding would be the most logical thing.
Well, breastfeeding would be covered under law stuff.
But if there was a drive involved of actual,
Yeah.
not expressing, but I was just curious. You didn't really say at the beginning of whether questions were involved, so that was my questions for you. It wasn't clear if I should interrupt with questions.
Yeah. Oh, yeah. That's fine. Yeah, I'm
Okay.
just thinking if that comes up. So, no, breastfeeding would come under more the breastfeeding policy. Other things, I think, would still be excluded.
Okay.
Yeah, it's mostly like
fitness.
Yeah, or like a fit
Classes,
for life
meditation,
activity, or
yeah.
Okay.
Great.
Yeah, great.
Thank you.
All right, and then within our environmental services department, so this one is highlighting flow, which is fit for life operator well-being, and this was another one of our multi-year process implementation things that we've started quite a while ago and just got off the ground this year. And Fit for Life sessions are now integrated within our new plant operator trainees as part of their standard onboarding process. So we get to meet with the cohort group 6 times throughout their 6-month onboarding and deliver a well-being curriculum that's specific to their work around the topics of stress resiliency, nutrition, sleep, fitness, and what resources are available to them. And again, this speaks volumes to the leadership support of allowing these sessions to be part of their normal training. One of the 6 sessions that the trainees received is the Resiliency and Thriving session, and that's another train the trainer model through the OWLS, so Organizational Wellness and Learning Systems. And that session was rated the highest of all of the 6 sessions, and we received multiple comments during the final discussion with the group that the skills they learned and their aha moments about how they deal with stress was the most impactful both at home and at work. And within our transit, Healthy Routes is very similar to that flow training, so it's part of new operators onboarding, so part of their training, they receive work-specific training on dealing with stressors. And then this is where we'll insert either a short story or a video of kind of an example of that within the transit agency. All right. So what we've learned, what works well, coordination and collaborating across other work groups, knowing your organization is key. So knowing when you need to work stealthily to get something done, as a great example of that would be with the environmental services training. That was, again, a multi-year process of planting seeds and easing our way through that to get that off the ground. But also knowing when you just need to ask explicitly, as was the case more with our Healthy Routes with the transit. We just asked, can we come into your training and do this? And it worked. So just knowing the different work groups and knowing where you need to be a little more coy and where you can be a little more abrupt. Working within other divisions, so sometimes that can be hard to kind of play in someone else's sandbox per se within the departments. So a great approach that you might be able to try is asking where you can help support their efforts rather than asking them to take on some of your work, whether it's promoting. So asking, what are you guys doing that we can help promote or tie back to? So that's been great. Leveraging your existing resources, knowing what your learning and development groups are doing, jumping at opportunities. If anything, if a work group asks you to come in, jump on it. Always be making those connections. Applicability, relatability, and representation definitely matters. You need to get the voice of your employees when you're trying to figure out what you want to offer and how you want to offer it. I know a lot about health and wellness and behavior change and wellness programming, but I don't know how to drive a bus. So if I come in and try to teach something to the bus operators, but I don't have any sort of talking points or relatability, it's gonna fall flat. So you need to have the voice of your employees in anything that you're customizing for your work groups. Even just as far as your promo flyers, your talking points, how you're explaining things, knowing that representation matters in those ways. We know that people love being together. We know that isolation and feeling like you're separated is a big thing, but we also know that when you're talking about mental health, and especially if someone's struggling, people also want some things to be more private. So having both is important. People definitely want to be heard and feel like the company values them. So a lot of times we hear that people don't think the company actually cares, or that something's just lip service. So making sure that you are capturing the voice of your employees, really asking them what they want. And this also really helps with that autonomy piece. So often if you're asking the operators what they're experiencing, asking for them to co-create some of these things with us, that gives them the autonomy even within their jobs. So that can help with that. And then don't be afraid to talk about hard topics. Jump in. Like we said, when we did the Make It Okay campaign, we were a little nervous about what the reception was going to be, and it was one of the most well-received things that we did. Some other things on where we have more work to do. Coordination and collaborating doesn't always happen as quickly as we'd like. There are certainly things that are still happening that we wish we would have been a part of, that we didn't have a seat at the table. So just know that sometimes it's a very long process, but keep trucking away at it. It will happen. Occasionally there is still a disconnect between the intent of what we offer and how the employee feels about it, either through, again, feeling like it's just lip service, or if possibly there was a trigger word in the explanation, or something didn't come across the way that we intended. So be very mindful of how you explain the offerings that you do. I love this one, continuous improvement of information finding. So oftentimes we ask a question and we get an answer, but it's not really the information that we need, or there's other information hidden in there. If anyone has not seen the TED Talk by Malcolm Gladwell, it is fantastic, but it gets to a great point that people don't know what they want. So we did many surveys, focus groups, a lot of talking, and a great example of this is within that Fit for Life operator well-being. We did surveys, we asked questions, we did satisfaction surveys, but one other piece of that program is they write a postcard to their future selves, and then we'll mail those back in 6 months. One of the most common things that people wanted to work on those postcards is to be financially stable, to be financially secure, to have their budget in order. Not once did we talk about financial health in that presentation, but that was really what they wanted. So that was a good key learning, that we don't always know if the questions that we're asking are getting to what we really need. Then the last thing, interactions with others can greatly impact someone's experience at work, both positively and negatively. So we know there are negative tables, they're called, in the driver's rooms, and that can have a great impact on even our best intentions, and what we offer sometimes can't combat someone's interactions at work. So we're going to go over next a way to help those interactions be more positive and impactful. So this is something called active constructive responding. And earlier I mentioned that frequent exposure to acquaintances is just as impactful as having a few strong relationships. So we're going to demonstrate and practice a skill that you can use both to build positive experiences with a stranger or acquaintance and build deeper, more meaningful connections with your existing relationships. So this is called active constructive responding. And research has found that our response to positive news is actually a better predictor of the long-term success of a relationship than our response to negative news. Pretty funny. And this is also a great skill that we practice within the happy hour training as well. So Kelly and I are going to demonstrate a couple scenarios and then break it down as to how that impacts a relationship. So, hey Kelly.
Hey, what's up?
Oh, not too much. How was your weekend?
It was good. How was yours?
It was great. We bought a house.
Oh, wow, that's cool. Oh my gosh, I had an epic weekend.
Oh,
My husband actually surprised me with a trip to Denver to see my best friend. I had no idea they were planning it. It was amazing.
that sounds really cool. So that would be an example of passive destructive response. So Kelly totally ignored the event that I just talked about. I bought a house, and just stole the conversation and talked about her own thing. So it doesn't feel very good. So let's go over now another scenario, how she could respond to my news.
Hey, Crystal,
Hey,
what's up?
Kelly. Not much. We had a great weekend. We bought the house.
Oh, nice. Oh, that reminds me. My aunt and uncle just bought a house on Lake Minnetonka.
Oh,
I'm
cool.
so excited. They have a boat. I can't wait to take the kids to the beach. It's going to be amazing.
Well, cool. That's great for them. So again, that's more passive constructive. So she, recognized that I bought a house, kind of, felt it was cool, but then just, again, took it away and went to somebody else, to someone other. All right, let's look at a third way of responding.
Hey, Crystal.
Hey, how are you?
I'm good. How was your weekend?
It was awesome. We bought the house.
Oh, wow. Oh, that seems like a lot of work if you ask me.
Well,
How are you going to keep up with all the maintenance with everything you have going on?
yeah, I mean, I guess we talked about it. We thought we could do it. So it'll be okay.
Good luck.
So this is an example of active destructive responding. So if she's raising alarm, she's deflating my good news, I no longer feel excited about what I thought was really cool. So all three of these responses shut down our ability to trust and grow a relationship. And if we don't trust the person that we're talking to, that connection is kind of cut off. So let's look at one final way of reacting to someone's news.
Hey, Crystal.
Hey, Kelly.
How was your weekend?
It was great. We bought the house.
Oh my gosh, congratulations.
Thank you. Thank you.
Oh, I know you guys have been waiting a while to buy something.
Yes.
So where did you end up
Oh my gosh.
buying?
We got it in Burnsville. It's in the school district that we wanted. It's got a great yard for the dogs and our son. Oh, it's just gonna be so much fun.
Fantastic.
Yes.
I'm so happy for you.
Oh, thank you.
That's
Thank you.
awesome.
Great. So So you can see how that feels a lot different. So this is active constructive. Kelly's showing genuine interest in what I'm talking about. It's amplifying the experience. We're mirroring each other's smiles and we're getting excited. And active constructive responding is the only type of response that helps a relationship. So now we are going to invite you all to practice this as well. So stay seated for now, but I'll explain this. When I give the cue, we're going to stand up, find a partner, choose one person to be the news giver and one person to be the respondent, and we're just going to take 30 seconds to practice responding to each other's news in an active, constructive way. At 30 seconds, I'll signal you, switch, so the other person gets a chance to give the news and the other person gets a chance to respond. All right, go ahead, stand up. And here are the key tenets again for active, constructive responding. Continue asking interested questions, get more information. You're reinforcing the positives, keeping eye contact, and then smile and mirror their excitement. All right, so go ahead and stand up, find a partner. 30
Planning like
seconds.
a minute.
Yeah.
So add a minute to our. Okay.
Cool. All right. And switch. All right, we switched. All right. All right, so come back together. So great. So again, this is a personal skill that you can use on your own personal basis to help build those acquaintances. This is a great thing if you have a new employee coming in to help welcome them and have them feel part of the team immediately. You can also use this kind of like the meditation. You can build this into more of a campaign, more of an organizational initiative. So there are various ways you can do this.
All right, so I hope that was helpful for you guys. Crystal and I are wellness and health promoters. We're not actresses, so hopefully that you still got something out of it. Okay, so to wrap up today, we just wanted to recap what we covered. So we talked about some workplace happiness factors. Crystal mentioned things like the relationship that you have with your supervisor, workplace incivility, burnout, stigma, and more. We also talked about some of those individual happiness factors, so things like potentially financial stress, ACEs, social determinants of health, just to name a few. We next talked about a few specific resources to help you address mental well-being at work. That was working with your employee assistance program and then implementing past positivity, take charge at work, or happy hour. And we're also leaving you with the resource list as well. Crystal then shared more about the various tools and strategies that they've utilized at Metropolitan Council and how they've made those work for the different departments and different limitations that they have as well. We practiced the loving kindness meditation as well as the active constructive responding to give you a feel for a couple of these tools. And then right now we're going to give you a moment to jot down your next steps so that you can feel ready to take action when you leave here today. So I don't know if there are any Rachel Hollis fans out there or not. I know sometimes you love her or hate her, but one thing she says is that knowledge is not power, applied knowledge is power. So in other words, knowing why and how to address mental well-being at work doesn't really do us much good unless we're actually willing to take some action and address it. So please refer to the back of your active constructive responding handout. And there are a few questions there that we'd like you to just take a minute quickly to jot down your answers to help kind of guide you in what you'll do next. Okay, did everybody have a chance to jot a couple things down? Okay, and then if we have time, I would ask if anybody wants to share. Otherwise, thank you very much for your attention, and we have a couple minutes for questions.